Welcome to the Acupuncture Outsider podcast. My name is Richard Hazel, and in the time it takes for you to commute to or from work, I hope to have shared something of interest about orthopedic acupuncture using motor points, trigger points, myofascial slings, neurofunctional acupuncture, segmental treatments, anything that crosses my mind that seems to be of interest. I hope you'll enjoy it. Hello, and welcome to another episode of the Acupuncture Outsider. This is Richard Hazel, and today I want to talk to you about treating seniors. This is a skill that one develops over time. There is no books to read about how to treat seniors for pain. There's no course that I'm aware of that you're going to take that explains to you how different it is to treat someone in their 70s or 80s for pain. You basically learn from experience. So I wanted to tell you the things that I've learned. I feel like treating seniors is, I have like a love-hate relationship with it, like I do with New York City. You know, there's some really gratifying experiences when you're treating someone who basically has no help from anybody for their chronic pain and mobility issues. And it is very challenging. One of the hardest things about treating seniors is not so much related to the results, but the time management and the expectation management for seniors. It can be very different from your younger patients. The skills involved for assessment are different. So let's talk about the differences with treating seniors and treating healthy younger people. So many of the orthopedic acupuncture courses are all about athletes, and there's a lot of prestige in being an acupuncturist for athletes. And I understand that everybody, loves to have famous clients, and athletes are pretty high up there on the respect scale in our society. So, working with professional athletes, there's a lot of, you get a lot more respect from people for treating professional athletes. But what you don't know is that treating young people is a lot easier than treating people 3 times their age or more. So I want to talk to you about what you really should feel really proud of yourself on. It's if you're treating older people and getting great results, because it is not so easy. The assessment is different and the muscles are different. They say we lose fast twitch fibers as we age. So, and some of that doesn't convert to slow twitch muscle fibers. It converts more to connective tissue. Like your muscles are becoming more fat and fascia than they are muscle. And that's not good. When your methodology for improving someone's level of pain is to improve the health of the muscles, you run into the ischemia and the fibrotic nature of an older person's muscles that don't really want to release a lot and are not going to stretch. And you have limitations on how well you can restore their muscles to a more elastic state. That is not to say that you can't help them and you can't improve their quality of life, because you absolutely can. You have to have realistic expectations for what is possible for someone in their 70s or 80s or 90s, as far as how elastic and supple the muscles will be after your treatment. They're still going to have a rigidity that is beyond our control. So the goal is to get the muscle restored to a better level, a level that was hopefully the way it was before they were in chronic pain. And what you may also find is that the muscle fibers that are responding and that are improving are fewer, which means when they are active, when they are being physically active, they have a limited number of muscle fibers to use, and very likely they're going to need more regular maintenance. I would say once a month, once you've got them out of pain. Just like for a pro athlete, the pro athletes need, twice a week or once a week because they use their muscles so much. And so even though your seniors are not being athletic, they don't have as much muscle fibers to recruit. So it's going to be the same ones all the time. And they're going to need more maintenance than say someone in their 30s or 40s. You reset hip flexors, for instance, on someone in their 30s, they may not need to see you for months. They're going to go out to doing what they love to do, and they're running and cycling, and they may not feel any dysfunction for many, many months. But you release hip flexors on someone who's 80, they'll feel better, but they might need to come back in a month because they just got less to work with. So the things to consider for treating seniors are frequency and healing time. How much stimulation can they tolerate? Some of those things you're going to learn in the first few visits, because you're going to go kind of conservatively on their first visit, knowing that you don't want to flare them up too much. When you start working on chronic pain, and I don't know, you're not going to find many people in their 70s and 80s where their pain is not chronic, going on for more than 6 months. Many times we're talking years, and they've lost track of how many years they've had this pain, and it just continues to get worse. So often for seniors, there's not much the doctors can do. They've done what they can do. The person has had surgeries, they're on multiple medications, and there's just not anything left for them. And because our Western world of medicine does not pay much attention to the red part of the muscle, they're focused more on tendons, the joints that the tendons cross, ligaments, nerves, nerve roots at the spine, not really thinking much about the red part of the muscle and the nerve in that muscle. So that's where we come in. And it's why we should be helping our seniors, because we are probably their last best option. And ironically, in the United States, the insurance policies that our seniors have, they're usually a Medicare plan, does not cover most acupuncture. And when it does cover acupuncture, it has to be done by a medical doctor or under the supervision of a medical doctor. And it's only going to be covered if it's chronic low back pain. And so many of the people that I'm treating have so many other things going on that are not chronic low back pain. And being that I'm not an MD, I can't even bill their insurance. So they're going to pay out of pocket. So it's too bad, because the people who most need us are not covered by their insurance. And I really think if our government wanted to control costs, like all those medications that you're loading our people up with, you would cover orthopedic acupuncture, and you'd cover it at a good rate because you'd be making money, or you'd be saving so much money on cortisone injections, nerve ablations, surgeries. So many times people are getting surgery for pain, not because of nerve entrapments that are going to lead to nerve damage. They're getting surgeries for pain, and I think that's really unfortunate. So our seniors need us. So when I see somebody, their intake usually lists multiple things that hurt and neuropathies, and they have previous surgeries, and they're usually there with their spouse or a kid, one of their adult children. Um, they're more difficult just to manage because they can't walk well. You need a stool so that they can get up onto your massage table. They usually can't move very well. They're in pain. And doing an assessment the way you've been taught to assess a baseball pitcher is not going to work. You're going to ask a lot of questions. You're going to want to know, where does it hurt? When does it hurt? Can you point to where it hurts? And in lieu of manual muscle testing, you're probably going to ask them to do things like, can you raise your arm in front of you? How high? Where's the pain when you do that? Can you raise it to the side? Where's the pain when you do that? Things like that. You're gonna want to see just basic movements and find out what they avoid and where does it hurt. And then you're going to put your hands on them. You're going to ask permission to touch their shoulder or their neck or whatever it is you're assessing. Maybe their hip, maybe their back. You're going to try to narrow down where the pain is. If you've taken courses with me, you know that I like to put the myofascial pain referral patterns in the slides when I'm talking about the motor point of the muscle. Not because I think everything has a trigger point, but the Travell and Simons pain referral patterns are very reliable ways to know where to start or where to look, because those pain referrals tell you a lot about what muscle's injured, and you won't necessarily need to be treating trigger points if somebody has those pain referrals. Those pain referrals are really helpful, and they're really helpful for working with seniors because the pain referral tells you a lot. One thing you might, when I think about shoulder pain, if the person, and you say, where does it hurt when you raise your arm? And they're touching the middle of the humerus on the outer part of their arm where there's no shoulder muscle. That is a very common pain referral from the middle deltoid, because that's where that deltoid insertion is, that deltoid tubercle on the humerus. So when they abduct their shoulder or attempt to raise their arm, they may have pain there at that deltoid insertion. So we know we're going to be treating the deltoids, especially the middle deltoid. And why is that overworking? Now start thinking about the supraspinatus. If they can't raise their arm very well, you're definitely not going to be doing manual muscle testing for the supraspinatus. But you sure can put your thumb on it and feel and see if they have soreness there. Of course, you want to know what their history is, if they've had any surgery. Has anybody suspected a full thickness tear of rotator cuff muscles? Anything like that, you want to know. And someone in their later years with a full thickness tear does not get repaired. It won't be repaired. They're just going to say, well, you'll be fine. Your deltoid can do the same thing as your supraspinatus. So you don't need a surgery for your rotator cuff tear at 80 years old. So just know their history, know what you're trying to accomplish for them, and know the limitations of what you can do. And you absolutely can help them to not have as much shoulder pain, even with a full thickness tear. So all is not lost. Work on the muscles that are still firing. And, I do use electric stimulation on motor points for my older patients. I just take into consideration that the first treatment is more about ischemia. It's more about getting blood flow back into the muscles that are causing dysfunction. So my conversation with the patient is, my hope is you'll have at least 50% reduction in your pain. However, the first time I treat you, we're really just getting blood flow back in the muscles. So it may take 2 or 3 sessions for us to start getting where I want to go with restoring your mobility and reducing your pain. So the first treatment may just get the blood flow back. And what does that mean? It means post-treatment soreness. And on somebody who's super ischemic and maybe not very healthy, maybe they are on blood thinners, their healing time can be quite a bit longer than your pro athletes. So they're going to need, we don't know for sure if they're going to be still having discomfort from the treatment when I see them the next week. I tend to book them a week out. And based on what they tell me on the second visit, I may start to ask to see them every other week so that they have more healing time. You're actually going to make better progress if you give the muscles time to heal. And for someone older, that can be 7 to 10 days, even if you only used motor points and even if you didn't use electric stimulation on the motor points, because you don't have to use electric stimulation on everybody all the time. I love it because it helps get the muscle firing better, not just release the chronic tension. And that's going to help. They have muscles that got shut off. Those muscles are really inhibited, and the electric stim is going to help wake them up. If you determine that your patient is too sore from treatment after your first and second visit, cut back on the electric stim and just retain needles for 20 to 30 minutes. Part of that challenge with working with seniors is you're going to probably need to be in the room with them the whole time for their safety. And so if you're one of those people who's making way more money than I am, and you're seeing 2, 3, 4, 5 people an hour, seniors might not be a good fit for your practice. I, I have a lot of patients who are in their 70s and they're doing really well, and that's why I have more of them, because they all have friends who are having pain. And so they send their friends. And if I'm helping somebody get feeling back in their feet, that's like a big deal. And they tell everybody. If I help somebody who has chronic back pain and sciatica, they're going to tell everybody. And those are things that we definitely help our seniors with: neck pain, neck mobility, sciatica, low back pain, hip pain. We can help them a lot. And, in all honesty, sometimes I know they're not going to be 100% pain free. But you know what? If they can sleep at night, if we can reduce their pain to a much more manageable level, that it's not keeping them from doing things that they want to do, that's a huge improvement. And if it's at a 1 or a 2 for them, that's a big shift for a lot of people. So my expectations are, I try to set my expectations to something realistic for the person, and I'm always trying to get them to 0 on the level of pain. But if it's not happening, it doesn't mean that it wasn't helpful um, to do acupuncture with that person. If it's down to a 1 or a 2, that's much more manageable for that person, and that's probably a level where the pharmaceutical that they're on is actually working for them or doing something better for them. So, pain referral patterns, the Travell Simons pain referral patterns, huge help for assessing the pain and what muscles to treat for your seniors when especially you can't do a lot of manual muscle testing. I I I'm not going to put my seniors through manual muscle tests. It's just they're just not mobile. Okay, their joints don't work the same. They're really tight. Everything's going to hurt. It's not going to help you figure out what to treat. You need to go based on where it hurts and your pain referral patterns, and then put your hands on your patient. You got to touch your patients. You have to press on the muscles that you think are the problem, and you will notice when they're very firm and they're sore and they're causing pain, you know you're in the right area. You know you're treating the right stuff. Not everything is going to hurt on someone that age, so you can still rely on palpation to find the muscles that are causing their pain. The ones that are not causing their pain are not going to hurt when you palpate them. And while with athletes, we're really thinking a lot about stabilizers, the shoulder stabilizers, scapular stabilizers, the traps and rhomboids and things like that, levator scapulae, etc. Sorry about that. For your 80-year-olds, do not worry so much about those muscles unless you think that something about them is restricting their mobility, like work on their lats. Definitely work on their lats. If you can get a little bit of serratus anterior, yes, that's awesome. But don't worry so much about getting into their mid back muscles. They're often not able to change clothes because they're just not mobile. What you don't realize is when someone's 80, it's an ordeal to change clothes. You do not have time management to have somebody in their 80s changing clothes in your room. You do not have time. It takes them an enormous amount of time just to get their shoes off and then to get them back on. So you really have to pick your battles, work on the muscles that are causing pain. Don't do something that takes a lot of needles. Really focus on the muscles that are causing their pain, especially in the beginning. If you have older patients who are very mobile and they're physically active, like this one runner that I've told you about, that's different. I can do more with somebody who can just hop right up on the table, has no problem getting back up, doesn't have vertigo, doesn't, I mean, there's a lot you're going to manage with somebody older. And that's the challenge. That's, the payoff is that you're making somebody's life so much better. If you are an acupuncturist because that matters to you, then it can be really rewarding to work on older people. If you're an acupuncturist because you just want to crank out 5 patients an hour and make a ton of money, this may not be your population. Stick with the easy stuff. Work on the young athletes. Stick with what you know you can do really well if that's your patient population. When you start working with chronic pain, then you're seeing the peripheral nerve entrapments, the neuropathies, the numbness, the radiculopathies. You're getting into a lot more complicated patient population. You need more time. You can't see 5 chronic pain patients in an hour. You just can't. Well, you can, but do you want them to get better? If you want them to get better, you can't do it. You can't spend 5 minutes, 10 minutes with a chronic pain patient. It's just not, that's just not how it works. Um, so there, those are the things you need to really think about when you're treating older patients. You kind of have to be psychic with them and tell them what they're going to experience in the next few days. You're gonna explain to them that you may feel good right now. The inflammation probably will kick in later tonight. You'll probably be sore all day tomorrow. If you are sore, use some heat, use a massager, you do something, get up and get your blood pumping. But heat pads are great for muscle soreness. Um, if you're sore for 2 or 3 days, that is not uncommon for someone older. If when I see you again, you've been sore the whole week from your treatment, we're going to go to treating every other week. It's not going to always be like that. We get better blood circulating in these muscles. It may take us 2 or 3 sessions to get the muscles healthier, and then you won't have so much post-treatment soreness. But it's a process, and it's totally worth it to go through this to get to a better place, because nothing that anyone else is doing for you is helping. And if you can focus on get through the next 3 sessions, 3 to 5 sessions, you'll see why it's worth it. And as few as that is, 3 sessions or 5 sessions, to somebody who is older, skeptical, has been let down by many, many experts, convincing them to come for 3 sessions can be tricky because they're paying cash and they're skeptical and they're really not quite sure it's going to work. So you have to explain what we're doing and why it takes longer for them than somebody in their 20s. And in reality, 3 to 5 sessions is not that much. It really isn't. And sorry, but at my rates at 110 a session, is it worth $500 to not have chronic back pain and sciatica? I think it is. I think even if you're on a fixed income, it is, especially if you're paying in once a week, once every 2 weeks, right? So I just lay it out like that and try not to let them make me feel bad because I'm charging money to help them with something nobody else has helped them with. Because they can inadvertently let on that they think you're too expensive at $110 a session. And I just remind myself, who else is doing this for you? And if this was a procedure being done in a medical office, you could add a 0 to the end of that. And you'd probably still do 5 of them. So, I have to stay focused on what I'm trying to accomplish for them, remind them of where we're going and how it should be. And if I feel like they're pushing back on me or expecting too much, I'll just outright say, listen, if you don't feel like this is getting you any improvement, I'm not here to pressure you to do it. I believe we can accomplish this, and I feel confident at this point that I can accomplish this. But if you don't feel confident, I'm not here to tell you to keep coming. So it's up to you. It's absolutely up to you. And the ones who stick around see the improvement almost across the board. The ones who do not have the patience for 3 sessions are just going to go back to doing what they were doing. And I have to be okay with that. But that's part of working with seniors is you don't get the instant gratification you get with a 22-year-old or even a 42-year-old where they jump off the table and they're like, oh my God, amazing. You get used to that with young people, young being like under 60. You get used to that. Like people get up, they raise their arm over their head. I had someone who cried last week because she looked up and she hasn't been able to look up to the ceiling in 4 years without pain. So that's what you expect when you're treating younger people. When you're treating older people, they get off the table and they're like, I don't know. You're asking them, how does it feel? Still hurts. That's normal. That's normal when you're treating somebody who's 80 and they have chronic pain for 20 years. So you don't get the instant gratification, but you got to stay focused and know that what you're doing is restoring mobility and elasticity to the muscles that are causing them pain. And if you're on the right track, when you see them, they will actually tell you that after a few days, they did start feeling better. But it takes that amount of time. So it's a challenge. That's my love-hate relationship with working on older people. It's huge gratification when you get to the good part and a huge amount of work when you haven't gotten to the good part, because the hard part is to remain confident that you're doing the right thing and that you know what the problem is, in spite of not getting the instant feedback that you get with someone younger. And also being able to really communicate with the patient what to expect from during the treatment, after the treatment, and 3 to 5 sessions out from now. There's a lot of communication involved. It's helpful when they have a spouse or a adult child with them, because you're telling them too, and they're going to help remind the person what you said, because not just being older, but being in pain can be very distracting, and people don't always hear what you're saying to them, even if you're saying it like I do 3, 5, 8 times. So it helps to have somebody there who's going to remind them what you said about being sore the next day or 2 days out. So you just got to say it, and you got to say it again, and then remind them that you said it, and then on their way out the door, say it again. And they'll still forget. But that's what it's like. That's how those are the challenges of treating an older population, and it's not as easy. It's just not as easy. But as you do it, you get a lot better at it, and you start to understand more about what you can do and what you can't do, and how to do these things. Even knowing how to bolster somebody who's older is different. So as you start working with more older people, you'll see, you'll have people where you need 2 pillows because their vertigo is so bad. You'll have people who can barely get on your table. They can't lie face down because of their pain, their back pain. They have to rely on their side. There's a lot more involved, and you learn it from doing it. But I wanted to kind of put this out there because there have been people who've asked me, like, would you ever do a course on like treating older people? Because that's their patient population. When I first started teaching sports acupuncture, motor point acupuncture, orthopedic acupuncture, whatever you want to call it, people would say, yeah, it's easy for you. All your patients are just athletes and bodybuilders. And that is not the case. Those are the photos that I post on social media. Those are the ones that, people want to see. They want to see young athletic people doing things that they aspire to, being treated. That's just how it is. But it doesn't mean I don't have significant number of patients who are older. And it's probably a little less, it's probably a bit more of a thankless field to be in. There's no glory. There's nobody's impressed by all the 70 and 80-year-olds that I'm working on, right? It's not, you don't get the respect that you get from, treating college and pro athletes. So that's what we talk about. We talk about the college and pro athletes because that's what you guys want to hear about. But in reality, a lot of our patients are, hopefully, your patients too, are older, and they're the ones who need us the most because there's not much out there to work on muscular issues that cause joint pain, arthritis, tendonitis, neuropathies. We are the best thing they have going, and they need us. And at some point, our medical system hopefully will start to recognize that, and they'll start getting the help that they need. Okay, sorry, long episode, but I hope a worthy topic, and hopefully I've planted some seeds for those of you who are just getting started with using orthopedic acupuncture techniques. All right, have a great one. Take care.